When our country was first founded, we didn't know what to do with people with mental illnesses. In 1963, President Kennedy signed a $3 billion authorizing act that would have created this wonderful national network of community mental health facilities. Not one penny of the $3 billion ever got appropriated.
There was a awareness that people with mental illness would at times get in trouble with the law, but I think the ability or willingness to sort of address it wasn't there.
We didn't have, in sort of like 10 years ago, 15 years ago, mechanisms to ensure that people who ended up in the jail, that jail could be an opportunity to enter treatment. We just didn't have those sort of opportunities previously.
14% of men booked into U.S. jails, and about 31% of all women booked into U.S. jails are seriously mentally ill at the time they're booked into jails.
What is it about mental illness that might explain such a frequent contact with the criminal justice system?
Why weren't individuals with mental illness being able to participate in alternatives to incarceration programs?
They have the stigma of being a criminal, and it's harder to get housing, it's harder to get employment, and there's a greater likelihood now that they're going to continue to recycle through the criminal justice system.
There are individuals for whom access to care and treatment at the front end, and even when they come out, can slow the revolving door that they often find themselves in.
There will always have been a significant number of people with serious mental illness in local jails, but our awareness of what the issues are and what an appropriate response is, that is what has changed.
I think we've gotten better at screening and identification.
A lot of times we treated mental illness and substance use disorders separately, and now we're recognizing that oftentimes they occur together, and the best way to treat them is together.
Research literature is clear that you cannot do sequential treatment. You can't treat one, then the other.
It's like other diseases, other chronic illnesses. You live with it, you manage it, and you move forward. And we know that's possible for folks with serious mental illness.
We know what good treatments exist. We know, that they are successful. They are often more successful than the treatments for heart disease and cancer, but we don't utilize them.
One of the barriers is that we're not effectively using limited money that we have available to us to do something different, which it may be to help people get access to work and education, factors that we know are going to really help with recovery.
It's a fragmented system of care that's very antiquated, and it needs a lot of reform, and it's horribly underfunded.
Makes no sense how we're handling this. We're spending a whole lot of money and not getting any of the outcomes that we care about. So why couldn't we use those resources in a way that still preserve public safety and help these individuals recover?